Welcome to Transform Now, the podcast brought to you by SS&C Blue Prism. Enterprise AI isn't just a tool, it's the heartbeat of smart organizations like yours, helping to reinvent work to deliver higher growth, more customers, and better experiences. Join us as we discover how AI-powered work orchestration and automation is making things better for everyone: customers, employees, shareholders, and most importantly, you. Let's get into the show.
Hello, everyone. Welcome to Transform Now. I'm Brad Hairston. Today, my guest is Peter Forbes. He is the Group Chief Digital Officer for National University Health System, otherwise known as NUHS, which is one of the major public healthcare clusters in Singapore. And he's also an SS&C Blue Prism client. Today, Peter is going to share his thoughts on automation in the healthcare sector and just talk about all the things he's learned over the last several years of leading the program there at NUHS. Peter, welcome. Nice to have you. Why don't you share a little bit more about yourself before we get going?
Thank you, Brad. Great to be here today. So I'm currently Chief Digital Officer here at NUHS in Singapore. Me and my team in Group Digital Office, we focus on automation as one of our big areas, of course. We also work on telehealth, on our patient-facing mobile application, and we're starting to look into work in omni-channel for communications as well. My background is in consulting and technology-enabled change. I've been doing that for the last 20 years, coming from a background in Boston Consulting Group and IBM, working across a variety of industries and now focusing, of course, on healthcare.
I did see that you're a former consultant like I am, and I wanted to ask you about that. How did your years in consulting prepare you for the role that you're in right now with NUHS?
Yeah, consulting's been a great background to have because you get exposed to a variety of different projects, lots of different challenges, lots of different organizations, and of course, project work. And what we're doing here in NUHS and with Group Digital Offices is project work, implementing new technologies, scaling those new technologies across the organization and working on getting adoption. So, of course, it's always a combination of work on people and the changes that they need to make to their ways of working, work on the processes, so getting those technologies into the processes, and also, of course, on the technology itself. But the technology itself tends to be the smaller part. It's the people in the process work, which requires more effort often.
Yeah, very, very true. I mean, at the heart of automation is process excellence, right? So I do think having a consulting background like you have makes a huge difference. Well, Peter, let's dive in. I want to ask you as we begin just to provide more information on National University Health System. Many people listening to this podcast may not be familiar with your organization. So give us a little background on it, if you would.
So National University Health System is a public healthcare system here in Singapore. We're also an integrated academic and regional health system. We have 3 acute hospitals: National University Hospital, Ung Tung Fong General Hospital, and Alexandra Hospital. We've got 1 community hospital, and we run 7 polyclinics, which are large primary care clinics. We also are affiliated with the National University of Singapore and the medical schools there, so the Yong Lu Lin School of Medicine, the Saw Swee Hock School of Public Health, and the dental faculty. We have around 18,000 staff. We run around 2,600 beds, and we train 6,000 students at any one point in time.
Interesting. Okay, that's helpful. It's a pretty big and multifaceted organization for sure. Lots of different pieces and parts to it. Well, let's talk about automation and just kind of how that came into existence at NUHS. So if you could take us back to the beginning of the program and talk about what were the drivers that created that need for automation? How was it sponsored? what kind of provided the basis to invest in this area and really get it going? And then from there, just explain how it's evolved over time to the current day. That would be great.
We started our automation journey back in 2019, and the work was actually started even before I joined. It was kicked off by our group chief financial officer, who had the foresight to go into automation. And through that work, together with our IT partner, Synapse, which is the health tech agency here in Singapore, the group CFO started to automate processes, including claims adjustment and insurance tagging. So these were really large processes in the financial space. And it started with a combination of not just the automation, but really starting from the perspective of, let's harmonize the processes first. And once the processes are harmonized, we can, in doing so, of course, also simplify the processes at the same time, and then add on the automation so that things can be done with less human effort. So there were around 5 large processes which were automated over the course of a couple of years. And then in 2021, we decided to take automation further and expand it into other areas of the business. So what we did was we set up a dedicated team on that with some dedicated resources. So we put in place dedicated team members, again, working with our IT partner Synapse, dedicated NUHS people also, of course. And then we put in place a senior steering committee made up of the group chief financial officer, again, myself, the group CIO, and the assistant chief executive from Synapse. So we then, of course, went out and started talking with different areas of the organization, really aiming to take automation into operational processes. And another thing that we did was, because we as a cluster run an annual budgeting process, what we had found previously was that sometimes the challenge is someone will have an idea for a process now, but they have to wait on the next budget cycle before they can apply for the funds. So in order to mitigate that, what we did was we set up a central budget pool, which was held centrally and managed by Group Digital Office and IT. And then if an institution, one of our hospitals, for example, had an automation idea, a process that they wanted to get started with, they can just draw down from that central budget pool and they can get started straight away. So this combination of having dedicated resources and having the budget pool really helped accelerate things and get things started quickly.
That's great. And it's really interesting too to hear that the CFO was the initial sponsor. I recently read an article that was in the US based on a survey given to a bunch of CFOs. It's one conducted by Duke University that they do every year. And the most recent one, 60% of the CFOs who responded said that they're leading automation and also AI efforts at their respective companies. So that really resonates to hear that you were led by a CFO initially. And Peter, as you talked about the way that it continued to build and catch on and then expand into different areas, what were some of the things you did to help build adoption and get other areas excited about automation? Because it had to be a brand new concept to many of them, that maybe they'd heard of it or they had experience in other places. But at NUHS, this was something very new and innovative. So how did you build that momentum as you went?
Yeah, so the first thing is that, as you mentioned, people are not always aware. And even if they're aware, they may not fully understand what automation is and how it can help. And often there's a misunderstanding that when we talk about automation, we're talking about physical robots or machines. And in fact, we're talking about software, of course. So what we did was we went out to different departments within the different institutions and we meet with them. We share with them a presentation, of course, on automation. We share examples, crucially, of where it's helped. We show them a video of the automation running so that they can understand that the digital worker is working through the existing software applications And we share with them the typical use cases where it can be helpful. So if there's a process which is running in a system where a user is clicking through lots of different steps at the moment, then that's a good candidate. If there's a process which is running across two different systems, there's not integration in place, that's a good candidate. And we share with them, of course, that if it's stepwise, if it's rules-based, minimal exceptions, and so on, those sorts of things work. And then whenever we can, we'll get someone from a previous process who has benefited from this to come in and tell their story, because that's the most powerful thing of all. If someone has gone through the learnings themselves, seen the benefits, then they're always the best ones to tell the story and share what they got out of it.
What I hear you saying is you're removing the mystery around automation and you're making it more tangible, more understandable. Those are great ideas and ways to really get people comfortable with it and to consider how it could impact what they're doing and their jobs. So that's really neat. So Peter, maybe you could pick a couple of examples of use cases that your team automated that were really, really impactful at NUHS. Can you share a couple of those with us?
Sure. So the first one that I'd like to share is medication home delivery. So when we were in the height of the pandemic in COVID-19, we were delivering medications to home in order to help patients so that they didn't have to spend too long in our physical facilities. And that led to very high volumes. So just in one of our pharmacies, in one of our institutions, we were processing around 200 deliveries a day. And all of those deliveries, of course, they have to be dispensed and they also have to be billed in the system. And this billing in the system was taking around 7 minutes per item. Through automation, we managed to reduce that down to 3 minutes per item, which was quite a big saving. So that saved around 400 man hours a month. And through this automation, the most important thing of all was before automation, we had a team of pharmacists actually sitting, doing overtime, doing this billing, as well as, of course, dropping the medications into packaging and sending them off to be delivered. And they were tired from having to do all of these long hours. So the great benefit there was that we saw that save them time and they were able to go home to their families in the evening instead of having to process all of these different medications.
Yeah, we don't want pharmacists doing billing activities, but we want them filling prescriptions. That's really what we need.
Yes, exactly. And in fact, some of the feedback that we got from them was that with this automation in place, they were able to spend more time also engaging with patients, which is what they want to be doing. They want to be talking to patients, explaining to them about their medications and helping out with the treatment.
That's great. And tell us another use case, if you would.
Yeah, so the second example is consignment consumables tracking. So this is an example for our operating theater where we were able to automate notifications to vendors for these materials, to process the invoices, and to improve visibility of the PO status. So in this area, the number of invoices was around 1,500 per month. And this process, which is now automated, saves around 750 man hours per month. So this is another example where there was a lot of manual work going on to physically track all of these different materials to process the invoices in the system. And with automation, we were able to take that away from a human, free them up to focus on other tasks. And so it's a great benefit.
Those are both fantastic examples. It's funny too, how many examples you hear from the pandemic era. The pandemic kind of got us all thinking a little bit more in an innovative manner, and automation certainly benefited from that in a lot of ways. So you talked earlier about how you've expanded from what began in finance into other areas. Talk about other areas you're hoping to expand into, maybe that haven't really been touched by automation yet. Do you have a punch list that you're working off of, if you will?
Yeah, so the first thing is that this process of engagement and gathering of use cases and candidate processes, it never stops. There needs to be continual engagement. And so another of the things that we do there is that we partner with other initiatives in the organization. So we partner with our process simplification initiative,
Mm-hmm.
which has top-down goals for our institution leadership. We partner with our employee simplification scheme, which is called GROSS, Get Rid of Stupid Stuff. So
Mm-hmm.
their employees can make suggestions, and we aim to automate some of those things which the employees suggest. We also partner with our innovation office, and we ran a
Mm-hmm.
large event with them in one of our auditoriums recently so that people can understand that automation is also an innovation. And so the new areas that we're looking to go into in the future is first to explore the clinical space. So we have
Mm-hmm.
one use case which is running at the moment where we aim to automate the process of entering lab results into one of our systems.
Mm-hmm.
And then a second area which we're exploring together with our chief technology officer is the combination of automation and generative AI large language models. So for
Mm-hmm.
example, picking up the output from an LLM and loading that into a system, or feeding some documentation into the LLM and taking a summarization or extracting structured text, for example. So these are exciting areas for the future.
Yeah, absolutely. And I would say that from our company's vantage point in talking with customers, healthcare and also life sciences are two industries where we've seen a very large amount of interest and also POCs and pilots and what have you with Gen AI combined with digital workers because of the information intensity that you have in this sector and the large amounts of documentation that are just constantly building and building all the time. Well, that's exciting. Let's talk about how you measure success. I've heard you talk about a few times we saved X number of hours here and X number of hours here. Are there other metrics or key performance indicators or whatever you want to call them that you use to gauge whether an automation is delivering the value that you expected?
Yeah, so the first thing we track is the number of processes which we're automating,
Mm-hmm.
and we report on that regularly. We also keep track of all of those different use cases so that we can share those across the organization. What's good in one institution can often be transferred into another.
Mm-hmm.
And then, as you mentioned, we track the man hours or FTE cost avoidance. So
Mm-hmm.
those are the typical things that we will look at. And of course, we also do a regular report back to our executive group so that they can see the progress that we're making
Mm-hmm.
and the savings which are coming out. And then again, also there, I also like to share the use cases so that they too can pick up on these things and take them back into their organizations.
Right, right. And I'm assuming your leadership also is curious about how each of these things is impacting patient care, because ultimately that's the goal, right? And we see that in the private sector with companies using automation and AI to try to make the customer experience better. But that's what I love about healthcare is ultimately patient care is what it's all about. So have y'all had to articulate that as a part of telling these stories and communicating how they're generating financial benefits as well as other types of more intangible benefits?
Yeah, so a couple of examples there where we've impacted patient care are, again, going back to the pandemic, we were running testing facilities and we had
Hmm.
a very large number of tests. And many of those patients were new patients who did not have a record in
Hmm.
the system. So what we did was we automated patient case creation
Hmm.
into the ERP system and also at the same time the insurer tagging. So this reduced the time that was required manually for each step from 2 minutes down to around 30 seconds. So that was a
Hmm.
big saving and also helped that same team, of course, who were doing the testing to focus on the patient, focus on the testing for the patient. Another particularly interesting example recently is that nursing have automated the process of inventory checking for their emergency cart. So this is a process that used to be run once every 2 months by a nurse physically going and looking through the various items in the emergency cart and checking that they have expiration dates, which are far out, beyond 3 months. So this was only done once every 2 months, or if they had to resuscitate a patient. So now with automation in place, that process doesn't need to be done by the nurse physically. It can also be done much more frequently. The cart's actually getting checked every 1 week through the automated process. And of course, that then frees up that nurse to be spending time caring for patients rather than doing this inventory management activity.
Great examples of how the patient wins at the end of the day from all these automations. That's great. Peter, what advice would you give to other healthcare organizations, regardless of where they are on the globe, that are looking to step into the automation waters and start to leverage this technology? How would you advise them just based on your own experience there at NUHS?
I would say, first of all, just get started. Finance is a great place to start. Operations and materials management, we've also found to be a good place to start. Look for those opportunities where people are spending a lot of time processing in the system, or where there are those integration gaps between systems. Do your engagement with the business, and as you explained earlier, demystify it for the business and make that engagement a continual process. If you can build a backlog of use cases, then that's a great position to be in. And then from there, our experience has been try to make it simple for the business. So by putting in place the dedicated resources, the dedicated pool of budget, then that helps simplify things for them so that they know who to go to. They know that there's budget there, there's someone who can help them and can navigate them through the process of automation, and also the IT processes behind this too.
I love the idea of keeping connections with those groups that you've done automations for. It's not a one and done. You're maintaining that dialogue because there's always going to be more stuff that you can automate in their world over time, especially with the way technology is innovating, and you're going to have the ability to do new things for them that you couldn't do a year ago or 2 years ago. That's something that many programs struggle with. They break the connection with the business and the program continues, but without that healthy pipeline of new stuff over time, it really diminishes what they can do. So I applaud your efforts there. Well, let's talk about just where things go from here. As you look forward over the next few years, you've mentioned AI is one thing that your team is really starting to explore, but what else do you envision will start to come into play for your program going forward?
So looking forward, I see the work continuing. I see that process of engagement needs to continue. Others going into automation should also engage with their partner. Their automation partner can provide them with a lot of use cases, can provide them with that experience that others have gone through. And those use cases are particularly helpful when talking to the business. So going forwards, we'll be exploring the clinical areas. We'll be exploring integration with generative AI. And we'll also be looking at how automation can stitch together the already existing technologies in the IT portfolio. So I see automation really as helping in two ways. One is, of course, removing unnecessary human effort and freeing those people up from repetitive tasks so that they can spend more time in patient care. And then the second way is in providing glue between different IT systems.
Yeah, absolutely. Well, congratulations on all of your success to date. It's very impressive, and I think the future is very, very bright for NUHS, especially with you at the helm and with the team you have working with you. So thank you so much for coming on the program. By the way, I'm going to use that GROSS acronym. That's a great name for an effort to get rid of stupid stuff. Is that what it was? Get rid of stupid stuff?
Yeah.
Haven't heard that before, so thank you for that. Thanks for being on, and I wish you the very best.
Thank you.
Thank you for listening to Transform Now, the podcast from SS&C Blue Prism. You can find all of our episodes on your favorite podcast channel, as well as YouTube. To stay on top of the hottest topics in the world of enterprise AI, subscribe now. The future of work is here.